the barriers that we have in pre-screening for potential patients is our system does not narrow down our screening capabilities. I did a search today. I'm looking for feasibility for a breast cancer trial. I'm looking at triple negative. And just by putting in the number of triple negative patients we accrued in 2017, it pulled up almost 200 names. The barrier to that is my search does not specifically say triple negative. I would literally have to go through 200 names to find those triple negative patients. That takes a lot of time. The Mendel search tool is basically pretty easy to use. I don't have to remember a study code. So one of the things I have to do is, for my searches, I really have to know a specific code, a diagnosis code, in which I would have to Google it or find out what it is. But with Mendel, I can just actually ask, show me patients who have squamous cell lung cancer who maybe express the mutation of PD-L1. And it would do that search for me. The other way, I would have to look at every single patient and find that and read the report myself. What I like about using Mendel is that all of the tools that I use for screening are right at my fingertips. In other words, in my previous way, I would have to pull up a screen for inclusion-exclusion criteria for all of my clinical trials. That's already in the Mendel system. And what's great about it is Mendel can associate patients who are potential candidates for a clinical trial. Mendel scans all of the clinical records so I can know right off the bat, once that patient is pulled up, whether that patient is the correct stage, has the correct histology, if I'm looking for adeno or squamous, has the correct line of therapy. So I will know just by the documents that are pulled up, all of the treatments that the patient has. I wouldn't have to go through so many screens, so many tabs as I would have to if I was in my own EMR. I don't want to have to sit around and wait for a trial to come to me. And one of the things that comes to my mind is we see, say, gastric cancers, or I see many esophageal cancers. I think the other day I've been looking at liver cancer trials. I haven't had not one hepatocellular trial come to me. And if Mendel can say, you've got a population of liver cancer patients and there is a study out there, I enjoyed working with the Mendel team.